Hang on.
Okay.
I just got to get my agenda on.
Good afternoon. Welcome to the Human Service Committee meeting. I'm Jan Burdick, Chairman, and I would like to start the meeting with the pledge. Please join me. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We will now have roll call, please.
Mrs. Burdick.
Here.
Mrs. Ricketts Wales.
Here.
Mr. Barnes.
Present.
Mrs. Hanchett.
Here.
Mrs. Root. Mr. Rumfelt. Mr. Stockin. And Mr. Harris. 5 present, 2 absent.
Thank you. And I will take a motion to approve the minutes of July 17th.
Ricketts Wales?
Hanchett will second.
Any corrections or comments? All in favor?
Aye.
Opposed? Carried. Thank you. Now we will go to Anita Madison, Director of the Office for the Aging. Welcome, Anita.
Thank you. So the first thing on our agenda is the monthly report. Is there any questions on the monthly report? If not, the only things that I wanted to highlight were the meals. The meals are down a little bit. We see that in the summer because family usually comes in. And sometimes when family comes in to visit, then families cancel meals because they're preparing meals for their loved one while they're here. We'll see that go back up actually at the next monthly report because this is for June units. So we usually see that about that time frame unless COVID is at a height, and then we don't see that because families stay away when there is COVID going around as heavily as it was at this time last year. We had a higher number, and that's why.
Okay. Anything else you want to point out, Anita?
Nothing really. Everything is pretty much the same.
Okay, so we can go to your New York State Unmet Needs Grant.
Okay. So for this, we are looking to increase our 2024 budget. The state did give us a supplement of $63,422 is what we are looking to increase our 2024 county budget. So we are looking to go from $316,753 to $380,175. And again, that is because they gave us more money as a supplement for unmet needs that we're not expecting.
Stockin moves.
We have a second.
Hanchett will second.
Any questions? It's always good news to go up and set it down.
It is always great news. We appreciate it.
Yes. All in favor? Aye. Carried. Thank you, Anita. And then create and fill.
So this is a request to create and fill an aging service specialist position. This is actually one that is 33% county, 52% state, 15% federal.
We have a motion to accept that.
Barnes.
Second.
Ricketts Wales?
Any questions? All in favor?
Aye.
Carried. Anything else today, Anita?
The only other thing is I would like to say thank you to everyone who participated in our senior picnic, came to help, and everyone who joined us for the day. It was a huge success. We actually ended up having to turn vendors away because we ran out of room, which is the first time that we've ever had to do that. But we ended up having to turn 4 vendors away because we ran out of table space, and I don't know how many more tables we can put underneath that tent. And it's good that we had the tent this year. It did sprinkle a little bit, but it was not a bad day, I would say. As far as weather, it held off until the next day, so we were good. And I just want to say thank you to all of you.
What was the attendance?
We had 493 participants. We ended up ordering 760 chickens, which we had to up that count twice. We had 39 vendors. And total volunteers between department heads, just volunteers who were coming out of the woodwork, legislators, we had 162 total volunteers. So
Very nice.
it was a great day.
Mr. Barnes?
Yes, going back to your Meals on Wheels, you say that people will call up, and do they call up and cancel for a certain period, and then restart, or do they have to call you back, or how's that work?
Yep, so if somebody wants to cancel meals, sometimes they go to a family's house or a family comes in, they'll say, I'd like to cancel meals for this week. And they would have to let us know that. They just tell us the dates and we put it into the system that we have, and then we would restart them. We do have people who go into the hospital, and we have the hospital that call and say, you know, you need to cancel the meal for today. We'll call you when they're going home. So there's lots of different reasons and different timeframes that people would be able to call and cancel. Sometimes they'll call us back to tell us to restart. Sometimes they just give us a time frame and we restart them.
If they don't, if someone just leaves to visit family or something like that, what happens if they deliver and there's nobody there? They just stop the delivery, or what?
Well, if they are not canceled and they're on the route sheet and the driver goes to the home and the client is not there, the driver actually calls us back at the office. We have emergency contacts, and then we call the client first. And then if we can't get a hold of the client, then we start calling the emergency contacts to see if we can locate the client. Sometimes it's they had a doctor's appointment and they forgot to let us know, but the driver is instructed to continue through the route until we get back to them, to let them know if they have to circle back around. Maybe the client didn't hear the door. There's lots of different things that could happen. Or if we just don't go back and deliver the meal because the client is not home.
Thank you.
You're welcome.
On the picnic, Anita, I just want to please relate to your staff, what a wonderful job they all do. I know it takes a team to put something like this together and make a success out of it, and they did, and I think everybody appreciated it. I made the comment to you, I said, I don't think you have to worry about a little rain stopping any of our seniors, because it was a great turnout, and the weather wasn't forecast to be that great, and it turned out fine, so thank you and all your staff.
Yeah, they are an amazing team, and we did have people calling the morning of saying, can I still come? So a little rain doesn't stop our older adults.
Thank you.
So thank you.
I wanted to just mention, thank you again for the senior picnic. It really turned out nice. What I was pretty impressed with is that the number of youth that you had volunteering. I don't think I've seen that many youth coming and volunteering, and what a great way to start them in for community service.
Yep. And it is great. It is started with family from the staff. A lot of them were grandkids, and I know that, you know, you brought some as well, and it's great to have the intergenerational, and our seniors love it, and the kids love it. They actually say, are we signed up to come next year? And I said, I don't have a date for next year, but yes, you're on the list. So I love to see that enthusiasm of the younger adults too. So thank you. And thank you for your contribution
It
as
was a
well.
pleasure, and my granddaughter loved it. She can't wait to come back, so.
Wonderful. Thank you.
Any other comments for Anita today? Thank you, Anita.
Thank you.
Tyler Shaw, Public Health Director. Welcome, Tyler.
Good afternoon. Just some updates. I did leave with Tiffany for the meeting minutes. We're having a free animal rabies clinic coming up here in September 28th at the Genesee Valley Central School Bus Garage. That'll be from 9 a.m. to 12 p.m. Please pre-register by the 27th of September. Just wanted to say huge thanks to Genesee Valley, who allows us to use their space. We typically vaccinate anywhere from 200 to 400 animals at most of these clinics, so it's a great undertaking.
Very good.
Last month, you had asked about some trending on our communicable disease report, so I did pull some of those numbers. Really, the only one that was significant from 23 to 24 was Lyme disease. In 23, we had 136 cases from January 1st to July 1st, and we're up to 154 this year. So a little bit of a jump in the Lyme disease cases. Not surprising to see that trend based on the last winter that we had. Did want to remind everyone that we do investigate over 80 different communicable diseases. I only highlighted 10 on my reports. If you have any questions on specific diseases, what their trends are, happy to bring those in at any time. Not the diseases, just the information.
Thank you. All right, then anything else you want to highlight on your monthly report? And if not, we'll go right to your requests to fill.
No, pretty standard monthly report unless there's any questions.
All right, well, we'll go to request to fill the senior caseworker.
first on my list. Sorry, that's DSS, I'm
Oh,
guessing.
I'm sorry, I'm
Yep.
looking at the wrong one. We want to go to the Olean Registered Record Administrator contract.
Yep, so we've had this long-standing contract with Olean General Hospital for Registered Record Administrator, which is basically our electronic medical record. If we ever ran into any issues with a patient's record, we have to have this for our diagnostic and treatment center. We've never executed, or I say executed, we've never used this contract, we just have to have it in place for some of our state audits.
Can we have a motion to approve that?
Hanchett will move.
Ricketts Swales will second.
Any other questions? All in favor?
Aye.
Carried.
Okay, next up is a preschool contract for occupational therapy with Alexis Malat.
We have a motion to accept that.
Stocking.
Ricketts Swales will second.
Any questions? All in favor?
Aye.
Carried. And then another preschool contract.
Yep, last on the list is speech language pathologist Carolyn Painter for preschool services.
We have a motion for that one.
Ricketts Swales will move that.
Stocking.
Any questions? All in favor?
Aye.
Carried. Any other questions for Tyler today? Thank you, Tyler.
Thank you.
And next is Don Horan, Commissioner of Social Services. Welcome, Don.
Good afternoon. First up, the monthly report. Almost every category on the report has decreased with the exception of childcare and employment. Employment's good to see those numbers go up. That means we're getting more people into the employment programs. And child support cases are going up. We're starting to get caught up on those.
Good.
Okay.
Anybody have any questions on the monthly report? All right, then we will go to you for senior caseworker.
This is a result of resignation. This person is going to go home and be a stay-at-home mom. So
nice.
we are going to have to replace her to keep cases low for each worker.
Okay, can we have a motion to do that, fill that?
Hanchett will move.
Second,
Ricketts Swales.
any questions or comments? All in favor?
Aye.
Carried. And then we have another case manager.
This is also due to a resignation. This person is going to go to work in the field that they went to college in and go back into the teaching field, is what I've been told.
Motion to approve.
Ricketts Swales.
Stocking, second.
All in favor?
Aye.
Carried. And then you're going to fill your attorney position.
Yep. This one we have to renew. We are still actively looking for another attorney in social services to help out. We still have a contract with another attorney who's covering child support. But we really need to get another one to help out our current lead DSS attorney. The work is just piling up, and we work a lot with the county attorney's office, who helps out tremendously. But we really need to keep looking for that attorney to cut back on caseload for the current one.
How long has this been open now?
I want to say a year and a half. Yeah, a year and a half. And we are desperately looking and reaching out, and I've worked with Allison on a lot of it, and she's been reaching out, so we continue to look.
Thank you. Any questions? Or, we have a motion first, and then,
Ricketts Swales will move that.
Hanchett will second.
right now, any questions? And does this one also have to be a county resident, this position?
I'm not sure.
I think it may be, or maybe from adjacent counties. This is not a public officer that takes an oath of office. This is actually a civil service position that they look at their qualifications to make sure they're able, they're not tested, so.
Thank you. All right, all in favor?
Aye.
Good luck. We hope you can get it filled.
I hope so.
Yeah, all right, and then we have a social welfare examiner.
Yes, this is to fill a vacancy, to keep caseloads down for everybody else, and to keep people getting the benefits that they qualify for.
We have a motion to approve that.
Stocking.
Second,
Ricketts Swales.
any questions? All in favor?
Aye.
Carried. And your public health nurse,
Yes. This is for to bring in a part-time, temporary, full-time person. We are looking for a new RN. Our other RM had resigned and relocated to another part of the state. We are actively interviewing right now, but there are certain services that are mandated that we have time limits to cover. If we don't make those time limits, it makes it so that the persons who are applying for the benefit will have to start over if we can't keep up with the time limits that the state has set. So it really puts them at a disadvantage to start the process all over again. So we'll use the same one that we did. We've contacted her, and she's more than happy to come back in.
All right, can we have a motion to fill that position?
Hanchett will second.
Any other questions?
Is this covered in your budget? I see it's a new,
Yes, it's covered in our budgets. It's already budgeted for.
okay, thank you.
All in favor?
Aye.
Carried. Okay, and then your HEAP contracts, one with the Office for the Aging?
Yes, we're required and mandated to have 2 alternate certifiers for HEAP. This one that we have with the Office for the Aging, they take care of all the applications and get those rolling for our elderly population.
Stocking.
A second? Any questions? So just to clarify, they do all the seniors and you do everybody else?
They do almost all the seniors, but if one shows up, we do those. So,
Okay.
but it's just that they're in contact with them more than they're in contact with us. It makes it easier for them.
Sure. Okay, thank you. All in favor? Aye. Carried, and then the one with Accord.
The Accord is going to be the second certifier, and they they don't do a lot of applications, but these are people that go into Accord for their services, and then if they find out that they could qualify for the HEAP program to help them out, they'll do the application for them, and then we'll finish it off up here in our unit.
All right, can we have a motion to accept that one?
Hanchett will move.
A second?
Ricketts Swales will second.
Any other questions? All in favor?
Aye.
Carried. And finally, the daycare budget modification.
Yep. With this here, the $584,650,000, I have never seen a program grow as quickly as this one has due to the state standards being changed for who qualifies under the income eligibility limits that are set forth under the regulation. For example, we had budgeted in 2021 $278,000, and we came in at $110,000. 2022 we budgeted $270,000, we came in at $177,000. In 2023, you'll remember that we did do the budget modification back then. We budgeted $210,000, and we came in at $559,000. And this year, I thought I had it taken care of with what the standards were when we put the budget together last summer. And I've been tracking it month by month. I've also been in contact with New York State Office of Children and Family Services to make sure that they're tracking and our numbers are agreeing. We budgeted $550,000 for that, and my new estimate now is almost $900,000 this year. The one thing that I did when I put the budget together last year, which is a recommendation from the auditors, is we try to budget for what we are going to spend, even though there's a bigger allocation out there. Our total allocation for the daycare program is $1,134,651. With this budget modification, it will put us right at that limit. And with my projections that I have right now, that should cover what we need to do for the rest of this year. So, and it would be in 98% of our daycare is 100% reimbursable. So this will not have an effect on the local share.
Okay. Any questions? Jennifer?
I'm sorry, I'm not familiar with this, but
Yeah.
is this daycare program for families so that they can get help with daycare costs, or is this for daycares to themselves?
No, this is for the families.
Okay.
Yep. they can come in and we encourage them to go out and seek employment to get back to self-support. And so they can come to us, Accord will do the certification, and then they will go out and seek a daycare provider for the family, so they can either go out and do so many job searches a week, and then when they find employment, they can have daycare for while they are working. Yes.
About how many families does this cover? Do you know?
On the monthly report right now, we have let's see here. This is 93 families.
Okay, any other questions? Any motion to approve it?
Ricketts Wales will move that.
Hatch will second.
All in favor?
Aye.
Carried. Thank you, Don.
Thank
That
you.
was kind of eye-opening.
Yes, it is. Well, it's growing so fast.
Do you have a reason, or do you know
It's from
why?
the income standards. I did print out the income standards before I came up. So like a family of two can make up to $73,000 a year and qualify. A family of four can be at $108,000. And if you go to the census for the county, there's not a lot of people here that have combined incomes that are six figures. So it's really opened everything up for pretty much everybody in the county, which is a great thing. So everybody can get back to work. But we just didn't expect the state to make those income levels that high.
Yeah, I can see where that would make a huge difference.
Yes,
Yeah.
huge, huge difference.
Yeah.
Thank you.
Thank you, Don. All right. Dr. Anderson, you are up. Welcome.
Thank you for letting me present this and try and get your approval to do this. I'm assuming you all read what was sent out, or that you have some familiarity, but this in the budget is covered under what we call the mental health law. And you can't predict what it's going to be, because we don't know how many people we're going to have to send to the hospital for forensic reasons. That's undeterminable until after we do it. Up until 3 years ago, we paid 50%. But 3 years ago, the state decided the counties should pay 100% of the cost of what they call restoration. So somebody, I obviously started without telling you probably the key thing. A 730 exam is what we do when somebody is being determined competent to stand trial or incompetent to stand trial. So if one is determined to be incompetent, we need to send them to a state psychiatric forensic unit, which in our case is usually Rochester. And the cost then comes back to the county at about $36,000 a month. And someone is there for an indeterminate length of time. Currently in the law, in the statute, it says until restoration, which means until they're competent to stand trial. Not in this county, but in another one that I've been in, we had one that was there for 3.5 years. Now, that was back when it was only costing us $14,000 a month. And you can imagine what that would do to our budget if we had someone, even at $14,000 a month, for 48 months. So we're trying to get the state to look at the costs and them taking over those costs because it's their mandate. And in order to do that, of course, we need to change the statute. And as you noticed, this proposal was written by the Conference of Local Mental Hygiene Directors in conjunction with the state senator's office that is supporting it, and I'm sorry, I can't remember the name. So what we're trying to do is get them to revamp the whole situation, not just the pay, but why does someone go there and what does restoration mean? You're never going to, I shouldn't say that. It is highly unlikely that you're ever going to restore somebody who has an IQ of 45. It's just not very likely. So if they get sent there until restoration, that's, it's unfathomable. You can't figure that one out. So we're trying to get them to put limits on what restoration would be and how long you would be there for restoration. And that's to benefit the patient. To benefit the county, we're looking at the money. Just plain and simple. We have one individual now, and it's costing us $36,000 a month. Fortunately, that individual is not likely to be there more than 2 or 3 months. So, the other thing is that this resolution is trying to do is standardize the 730 exam statewide. Right now, when I do a 730 exam in Allegheny County, it could be quite different than the 730 exam given in Columbia County. So they want to standardize them. They want to standardize the payment that we do, because there have to be 2. I can only do 1. So we have to pay at least one other psychologist to come in and do the exam. And we'd like to have that more standardized, so.
All right, let's have a motion first, and then we'll open up for discussion.
Ricketts Swales will move it.
Hanchett will second.
All right, Mr. Healy, I believe your hand was up first.
Thank you. So to standardize this exam across the state, it seems to me to be rather difficult because it's probably pretty subjective depending on who's doing the examination, or no?
Standardize, I'm sorry, I should have brought in my folder. I just got out of court doing a defense of why I thought the guy was competent. And there's what they call the Dusky standard that you try to meet. And what we're doing is trying to get everybody in the state to use the Dusky standard, okay?
Thank you.
It won't be everybody has the same form. Okay? It will be everybody gets paid the same amount.
Would be still somewhat subjective, or no?
It's extremely subjective. If you could have been in court today, you would have enjoyed the repartee between the attorneys and the psychologists, because those of you that have any knowledge of psychology know that it is not an exact science.
No, well, fortunately, our experts on this end of the state have a little more common sense.
We think so. We think so. Anyway, are there any other questions?
Mr. Harris?
Just a comment. I think this has been an ISAC priority since they did the cost shift back in 2021. So every year, I think it's been on NISAC's legislative, priorities without much success. But I think it's great that, we'll move it forward and pass one locally. It probably will be at conference again this year. But NISAC does have a white paper that I'll forward to the board that details some of their thoughts on how to navigate the problem. But appreciate the doc bringing it to our attention.
NISAC did present this at a standing committee in February, and I did give Dr. Anderson a copy of that.
Yes.
So, all right, any other questions or comments? I just have one question, Terry, do you have any idea, how do you budget for this? Because it's an
I
unknown.
go to the treasurer.
Yep.
And I say, what do you think? And she rolls that magic dice that die that she has, and she tells me.
Well, it's one of those accounts. There's another one in the DA's office that's very similar. We don't have a choice about it. We have to pay whatever it is. So we put an amount in there, and then when it goes over because of the case they might have, or maybe they don't have any cases that year and it just sits there. But if they go over, then we fix it at year end.
Okay,
So
thank
we
you.
just, it's just one of those things
Yes.
that it's, you could put $1 million in there and never use it, and that's not the way to do it, you know, and, or you can put 10,000 in there and you go to 50,000 within the first 3 months. So it's just one of those crapshoots, so.
I do know at NISAC, and I don't remember what county she was from, but it cost them, I believe, over $1 million in 1 year.
We've had years that have been high. You know, Doc and I kind of commiserate over it. But, yeah, we've had years that have been high, and then other times we've put $75,000 in there and never used it.
I
So,
don't think we had anyone in '23.
yeah, I don't think we did either, so, yeah. It's an interesting law.
Jen?
I, maybe I'm just, I mean, I think everybody gets this, but is there a standardized way for someone who has developmental disabilities to prove that they are able to understand the charges against them? What is the standard for that?
For developmental,
Someone who-
intellectual and developmental?
Yes.
Yes, there's a standard, because you still have, and I hate to keep referring to it, but that you still have the Dusky standard. And what that means is you are looking at a person right now. You don't go into their past history. You don't call their ex-wife. You just are evaluating that individual at that particular point in time and how he or she is reacting to the questions. So if you have someone with an IQ of 55, they probably can tell you what day it is, and they can carry on conversations a little bit, but they are not going to be able to do mathematical calculations, which is part of determining whether someone's competent. So, yeah, there's a standard, and it's do they understand the court process, and can they rationally interact with an attorney? Can they contribute to their own defense? So, it's from my perspective, it's really pretty easy to determine, and all of you would be competent to stand.
And any other questions for Dr. Anderson on this? All in favor?
Thank you
Carried.
very much.
Thank you, Dr. Anderson. Any unfinished business today? New business? Go to the order, and we will take a motion for adjournment.
Hanchett will move.
Brigitte Soils will second.
All in favor?
Aye.
Aye.
Carried. Thank you all.